Hey, welcome to Therapeutic Perspective, a podcast brought to you by Never Again Radio. I am your host, Sarah Dynan. I'm a licensed professional counselor and nationally certified counselor. Therapeutic Perspective is a podcast created to provide information to mental health specialists and clinicians on current events or trends in mental health. Our goal is to make information easily accessible to clinicians all over the world. This podcast is brought to you by clinicians for clinicians, and we hope you enjoy. Thanks for listening. Welcome to episode 1 of Therapeutic Perspective. Thank you for tuning in. My name is Sarah Dynan, and I am a licensed professional counselor and a nationally certified counselor. Here at Therapeutic Perspective, we provide information from specialists on current events and trends related to mental health. All of the information is brought to you by master's level clinicians. So it's for clinicians, brought to you by clinicians. Today, I am with my dear friend and expert, Lauren Fortunato, on the implications of COVID-19 on perinatal mood disorders. So according to the American Psychological Association, postpartum depression is the number one complication of childbirth, affecting 15% of new mothers, which I wonder if this could actually be higher, as this is likely just the number reported, and we know not everybody who suffers reaches out for help. Symptoms of postpartum depression include feelings of sadness and hopelessness, irritability, appetite changes, and sleep changes, and in some instances, thoughts of self-harm and even suicide. This occurs due to the drop in postpartum hormones in combination with sleep deprivation that comes along with having a new baby and emotional stress. Stressful life events such as the COVID-19 crisis can make new parents more vulnerable, which I thought it would be most important to talk about this today. As we continue to educate ourselves on providing mental health support through the pandemic, individuals struggling with perinatal mood disorders through these uncertain times is an area that many of us has maybe already seen or will see. So to help us learn more about supporting new or expecting parents is Lauren Fortunato. Lauren is a licensed clinical social worker and a licensed clinical alcohol and drug counselor. She received her undergraduate degree in social work from Rutgers University and her graduate degree in clinical social work from Fordham University. She has additional certifications in perinatal mood and anxiety disorders and motivational interviewing for substance abusers. She is the owner of Your Best Life, LLC, a private practice that provides individual therapy with a strong focus in maternal mental health and substance abuse in both New Jersey and Pennsylvania. She also works at the Department of Veteran Affairs as an LCSW, in which she oversees a contracted program that assists veterans.
Hi, Sarah.
Hi.
Thank you for having me on your podcast. I'm really excited to be here. And most important, thanks for highlighting this very important topic. It's one that I really feel extremely passionate about, and I just love helping new mothers and fathers and families navigate this process of birth and pregnancy, especially during COVID-19. I feel it's a time when we really need to be providing support for our families. Now is the new normal. We're all experiencing it together, but it's a crucial time to help these families in both pregnancy and postpartum. Us as mental health providers can really step up and educate our families and empower them, even with our current crisis. They'll manage to get through this time period in their lives, and they could still find joy in the experience, as different as it may be currently.
And I think that's really important to remind our patients or our clients of, is that they can still find joy even in this experience, even in this time of social distancing and not being able to see our loved ones. But there is still that hope to find joy even during these circumstances. So thanks again for joining me. And to start off, I thought maybe I could have you talk about perinatal mood disorders and what that encompasses. I think most of us, and I know for me personally, I'm more familiar with postpartum depression. But could you speak to us a little bit more on perinatal mood disorders?
Sure. And it's really important to discuss the whole perinatal mental health and what it encompasses. I mean, often like you said, you're more familiar with postpartum depression because that's what's always highlighted in the movies or on TV or the articles we read. And really, it encompasses so much more than that. And it can occur anytime during pregnancy and the first year of postpartum. So it's really important to pay attention to this, not just in the 2 weeks after birth, but throughout the first year. It's important for moms and dads and providers to be assessing this constantly, doing daily check-ins or weekly check-ins in some form, checking in on our moms and dads and making sure that they're okay, especially now when maybe they're not seeing people as much, not, having that in-person connection. We can learn and talk about ways that we can encourage that and develop that. Talking about postpartum, I always found it upsetting when you go into the doctor's office. I have 2 children, and both times, actually the most recent time, it seemed to improve a bit, which actually made me very happy. But the only time I was ever questioned about my mental health was 2 weeks after I gave birth.
Mm-hmm. Oh, absolutely. Yeah.
I mean, 2 weeks postpartum, someone asks you if you've been anxious or worried. I mean, for good reason. I remember reading the questions thinking, well, I kind of feel all of these, but am I suffering from depression, but I'm tired? I mean, these are normal things to be experiencing 2 weeks postpartum. But nobody ever followed up after that. So I think we're on the right track here by talking about it and highlighting it and bringing to the forefront these issues so that we can, continue those check-ins throughout the whole year, which we're doing. And I'm very happy to see that. But as we are providing more education, medical professionals are asking more questions, and we are advancing away from just handing mom a pen and paper and saying, here, answer these few questions, and walking out of the room. I think it's important that we're educating each other and our doctors, our OBGYNs, and even the pediatricians, all who will be encountering mom within that first year, and dad as well. But really, providing education on what to be looking for and not, again, like I said, not just handing the piece of pen and paper and walking out of the room and leaving mom to fill out this questionnaire while she has a newborn baby sitting there.
Mm-hmm. No, absolutely. Absolutely. And it can kind of leave you kind of hanging, like looking at this screening form, and then you're like, okay, then what? And no follow-up questions with it. So it is important, and it's good to see kind of some changes when it comes to that screening.
Yeah, so they're now we're using a universal tool, which is everyone is using, all the doctors, which makes it very easy and much easier for people to assess and study. And these tools haven't. So the Edinburgh Postnatal Depression Screen, or the PHQ-9. So the frequency of these tools has also increased for greater ability to capture a new mother's functioning. Now the recommendation is at least once in the 2nd and 3rd trimester, 6 weeks postpartum or their first postpartum visit, and then a repeated screen at 6 or 12 months, and even at the 3, 9, and 12-month pediatric visits. I found that very surprising when I brought my daughter in for her visits. They also administered this tool again to me. I was used to, with my first son 5 years ago, they just gave me this tool, again, like I said, 2 weeks after birth. But when I brought my daughter in recently, they were administering this screen throughout her first year, and I really thought that was great.
That is good. And do you know, Ken, as mental health professionals, are those questionnaires accessible to us to administer to patients if they come across our way and we want to screen them for?
Yes, we should be. We absolutely should be. If you have somebody in your office or you're reaching out to them, even if you're doing telehealth, this is an easy tool that can be found online through a quick Google search. It's a very simple questionnaire. And as licensed professionals, we absolutely can be administering these. The PHQ-9 has a few different questions, but it's also applicable to postpartum mothers.
And I'll have that link posted on our website as well so that all of you who are listening can have it accessible to you.
Thank you. That would be great. So like we were saying about, commonly hearing about postpartum depression, but also perinatal mood disorders encompasses anxiety, panic disorder, obsessive compulsive disorder. Postpartum PTSD can be very common if somebody's birth experience was traumatic or it was, totally different than what them and their partner had expected. Bipolar disorders and postpartum psychosis. Now, I just want to note that postpartum psychosis is a little different than the other perinatal mood disorders in that it is very rare. These are more of the experiences you see, and, this is a trigger warning, but you might see a story about a mother hurting their children, and we often wonder, boy, how can that happen? And a lot of women are scared to even report or answer these questions on their screenings correctly because they're scared their children might be taken away if they report they're depressed or anxious. And those really unfortunate circumstances are a result mostly of postpartum psychosis, and that is a severe and rare illness. It only occurs in 1 to 2 out of every 1,000 deliveries. But this is something that's very serious. So it can include hallucinations and delusions, suicidal or homicidal ideations. This requires immediate medical attention. If you have any moms who are reporting this to you or reporting hallucinations or delusions, sometimes the husbands call and they'll say, report things that are really concerning, and this is something that needs immediate help. This is not something where we're just trying to give treatment for. We immediately can call 911. You can call the PSI hotline, and the number for that would be 1-800-273-8255. Even you can text the word HOME, HOME, to 741-741. 24 hours, 7 days a week for immediate help. I just like to highlight the psychosis part and just how that differentiates from other treatment modalities, and that we must act immediately and get the medical attention because that is very severe. Whereas the other perinatal mood disorders, we're going to be talking about the appropriate treatment modalities for that.
And I think you bring up a really good point. Is some of our patients might be scared to report that because they're scared that children and youth is going to take their children away. But the thing I always remind people of is that, children and youth does not want to take your kids. They're there to help families get stronger and better together. But I think sometimes that stigma associated with children and youth, we automatically go to that fear. So kind of encouraging our new moms to talk about this in a safe way, knowing that talking about it is just a means to kind of help you get help. And it's not, nobody wants to be punishing you or taking your children away by any means. It's
you said it, safety. Mm-hmm. So I think providing that safety and education is so important. So we must be educated first as clinicians in order and know the factual information around that, and then we could provide the information to our patients.
Yes, absolutely. And I'll definitely post that resource, that 1-800 number that you just said. I'll post that on the website as well that you can go to after the show. So, but as I mentioned at the top of the show, the signs that we addressed that we associate with postpartum depression are feelings of sadness and hopelessness, irritability, appetite and sleep changes, and unfortunately, in some instances, thoughts of suicide or self-harm. So are there any that you would add to the list? And if we do see these signs in our clients, or if new moms are reporting these signs, how does somebody determine if they need professional mental health support?
You're right, these are all symptoms of any perinatal mood disorder. In addition, I would add that feelings of anger or rage is also an important one, and it's really actually increased during this time, probably because we have less outlets for stress. So rage is a pretty common one. Scary thoughts, lack of interest in the baby, or difficulty bonding with the baby can also be signs to look for. Now, obviously, our our hormones vary and our bonding varies. So if your baby doesn't come out and suddenly you feel like you are the perfect mother or you don't get those butterfly feelings, that's normal. That is not necessarily a sign that you're going to have a perinatal mood disorder. Those things take time, and everybody's different. Everyone's maternal instincts are different, and the same with fathers. But they can be signs to look for. So an important way I like to differentiate between, does somebody need mental health treatment or some, additional help, is that, so we all mostly experiencing the baby blues, right? And that's the first 2 weeks after delivery. That impacts 70 to 80% of all new mothers. So it's pretty common. And actually, I remember somebody very close to me pointed out, listen, when you have your first baby, I was about to give birth, they said, you're going to cry a lot. It's totally normal. You can feel sad over, the Hallmark commercial or whatever you see might make you cry that normally wouldn't have before. But if this goes on after 2 weeks, then you have some more things to think about. And that always stuck with me. So it's a really important thing to remember that weepiness and sadness and anxiety and fatigue, these are all normal things in the first 2 weeks as we go through the hormonal changes. But if after 2 weeks, 14 days, you're still experiencing these symptoms, then you might want to consider reaching out for some additional help. Often moms or dads do not feel comfortable discussing these feelings with family or friends due to high expectations we see, that are placed on us from society. Now we have Facebook, Instagram, TV, movies. These, unfortunately, are just a highlight reel of postpartum. We typically don't see, the realities, and this can be difficult for new parents. So as providers, it's really important for us to kind of educate our clients on the realistic expectations of having a new baby.
No, I absolutely think that brings up a good point. When we think of the commercials that we see for Pampers, it's all these really new and happy parents, and often nobody shows that more darker side that can come after having newborns. So somebody might feel, oh, there's something wrong with me. This isn't normal, and a lot of it is. It
is very normal, very normal. Even the anxious thoughts and the kind of intrusive thoughts is also really doesn't mean you have a perinatal mood disorder, and it could be so scary that nobody ever mentions it. But again, it's kind of normal. The difference is if you feel you're going to act on it, then that's what we were talking about with psychosis, or that it could be something more severe that you would need immediate treatment for. But when you can identify that a thought is harmful or wrong, right there, it should give you reassurance that you're okay, because this isn't right.
Mm-hmm. No, absolutely. And I think, too, with social distancing and everything with COVID-19, sometimes those support systems are in place to kind of help us. And I would imagine with now social distancing and those types of close relationships and those people coming into our homes is now discouraged, that kind of amplifies a lot of these symptoms.
It does. And, you could cover up a lot more when nobody's coming in. You also have less help, possibly, unless you have a family member that you're lucky enough to have quarantined and be able to stay with you. But, less people coming in can be a red flag that we often miss. So we really want to pay attention to those little things. If you're providing telehealth and your patient is on the computer, we want to kind of notice, did they not brush their hair? Even though that's hard as a new mom, that could be a, goal achieved. But, do they always present one way and then suddenly they're presenting another way? We just want to look for signs of that.
No, absolutely. And I like how you said, nobody's coming in as frequently, so they might not be monitoring them as closely. So it might just be the therapist or the clinician that they're doing telehealth with that notices it and can see it, as there's not as many people that might pick up on it as typically there would be in a normal climate.
Yeah, and what's so interesting with perinatal mood disorders is that it really doesn't discriminate. I mean, it can affect people of every culture, every age, race, and income level. So no matter what your job is, whether you're, planning to be a stay-at-home mom, or you're a lawyer, or you yourself are a doctor, I mean, it can affect anybody at all different ages. So it's really important to you as a clinician be aware of the warning signs and educate your families about that. Most families, like we said, don't really feel comfortable discussing their feelings with family or friends. So it is important to equip their OBGYN, their child's pediatrician, with these tools. That can be a real place where we are picking up on certain warning signs. And as discussed earlier, if you do believe one of your clients or someone you know is experiencing postpartum psychosis, immediate help is required. The thing I like to point out, even though this all can sound very scary and overwhelming, is remembering that treatment is available. Treatment makes things more manageable, and there should be no stigma assigned to getting treatment for any maternal mental health issue. Should be, offered to every mother and father. I'm really happy that recently I feel that the stigma is declining as we educate ourselves more and more, and that's really important to keep doing. So it's important to remember that with proper treatment and care, you can actually prevent worsening of these symptoms and you can fully recover. So there's really no reason to continue suffering.
No, absolutely. And I like that reiteration of the hope in recovery for this, because I think sometimes when we have our clients that are really feeling in despair and really struggling, they don't see a light at the end of the tunnel. They just feel like this is how it's going to be forever. But instilling that hope can be the key to making a recovery and encouraging our patients to continue getting help or talking to their doctors about maybe medications.
And that's our job. Sometimes our only job, if we can do nothing else, is to instill hope. So, we may feel at times insignificant or that we're not, say, experts in a certain field. But again, we are there to provide hope and encouragement and just let our clients know that treatment is available and that they can do this. And that, again, there is no reason to continue suffering, especially when you have this new baby and you have so much to do, so many jobs now to conquer, and you want to enjoy them.
Yes, absolutely.
And you should.
Mm-hmm. Good. And reminding our parents that they can enjoy this experience. And as we've kind of talked about after the baby is born and some of those struggles, I kind of want to talk about these parents out there who have found themselves pregnant over in recent months during quarantine, and some of the grief associated with it. There might be some expectations that new parents would have when they find themselves pregnant, as far as planning for baby showers, gender reveal parties, talking about birth plans and who's going to be in the room when we deliver the baby. Are our grandparents going to be there?
All those exciting things that, we're so excited, especially if it's your first. You're just, and any second, third, any of them, it's just, those are the exciting times.
Yes. And so obviously with COVID-19, some of these, with the guidelines that have come out, some of these things aren't possible anymore. So how can we help parents cope with some of these unknowns, like as they are unsure of what their birth plan can look like based on who can be in the hospital room, and some of these losses and disappointments that they're faced with not being able to have these large gatherings to celebrate their pregnancy?
Well, you're right. So navigating this time now with COVID-19 and this pandemic can be really difficult. Childbirth and pregnancy are already a stressful experience in itself, and now adding all of these unknowns about COVID-19 and the ever-changing guidelines, we can really be having an increase in fear and anxiety. So what I like to do with my clients first is kind of have them normalize it all. Just let them talk about it, provide validation, and again, like we said before, provide support. Let them know that these are common fears and sources of anxiety anytime, but they're highlighted now during this global pandemic. It's so normal for our minds to start racing and coming up with a million different scenarios. That's normal without COVID-19. So now it's even more important than ever to equip ourselves with enough knowledge to feel comfortable and safe in knowing our plan. And also to step away from news outlets which can cause information overload, which I'm sure you know much about.
Absolutely, absolutely.
As do I. Mm-hmm. Sometimes you just have to say, wow, why am I watching this over and over? Mm-hmm. You know, just turn it off. Or what I really like to suggest is pick one source of information that you really trust, whatever that may be, and just stick with that one source, because everybody's going to be reporting things from a different viewpoint. You can pretty much find any answer to anything you want to hear these days because there are so many different views out there. So pick your one trusted source that you and your partner agree on and go with that. You know, that alone can reduce so much anxiety. Absolutely. And turn off the TV.
Mm-hmm. Absolutely.
And limit it daily, you know, maybe 20 minutes a day or something. But this is going to be changing as doctors and your OBGYNs and the hospitals all receive new information. So kind of just understanding that we're in this, you know, weird time to navigate, and we're just going to have to try and be as flexible as we can through it. I think sometimes that can take a lot of pressure off of having to know everything. You know, it's something that we want to do, but as we know, even before COVID-19 and even just during pregnancy and birth, we have kind of no idea what's going to happen, or we may have the best plan but we can't control exactly how it's going to happen.
No, absolutely.
So again, I recommend obtaining your information from your local hospital. Finding out what their plans are, and just educating ourselves and being proactive. You know, develop a community to help us in pregnancy and after, even if it may not be in person.
Yeah, maybe setting up a community of like Skype calls or FaceTime.
Yeah, it may be different and it may be virtual, but we can still develop that community and communicate to your family and friends kind of what you and your partner's expectations are during this time, and see what they're willing to offer. It's gonna vary. Everybody is kind of navigating through this in their own way, and just do check-ins, you know, just find out how everybody's feeling. So it doesn't replace human contact, but it's much more helpful to have this plan, and even if it's virtual, to feel connected.
No, absolutely. So it's important to kind of have some supports in place and try to maintain that connection virtually, and like making it a point, even if you're somebody who's more introverted and maybe doesn't like phone calls, like encouraging our clients to kind of step outside of their outside of their comfort zone to reach out and to connect for the sake of maintaining their mental health. I kind of want to move to maybe some of the conflicts that might arise within a family, because not everybody is going to be on the same page. So you might have new parents that are really worried and they don't want to see their parents after the birth or during their pregnancy because they're afraid of exposure, where that might be an opposing view for their in-laws or for their parents, who think it's okay and feel like the expecting parents are trying to offend them or hurt them in some way, when genuinely it's their concern for their child's safety. How can we encourage our clients to work through maybe some of these conflicts that would arise?
Like I mentioned earlier, I think it's really important to develop a plan with your partner. And once you have that plan, then that's really what is the basis for your decisions. So you guys come to an agreement based on whatever information, again, you guys are going to. And, you know, you can't check in with you can't go to each person and expect them to kind of give you their input on the plan. Even without COVID-19, you know, there is so much unsolicited advice as a pregnant woman to moms and dads that now with COVID-19, it's, you know, obviously increased even more. So we just want to develop our own trusted plan, and then, you know, you can relay that plan to your family and friends. So you might relay it, say, through a funny email, you could title it social distancing baby or whatever you want to do, but maybe through a group text or an email to all of your family together so that one person doesn't feel singled out. And maybe your mother-in-law doesn't feel like, why are you telling me I have to quarantine for 2 weeks? No, this would be everybody coming into contact with our baby. This is what we expect. So I think doing that as a whole would really be helpful.
And I like how you said, like, using humor. So it doesn't have to come off as something as like a list of rules for my baby during COVID-19, but you can use humor. Like, here's what we're going to do for the socially distanced baby. And I really like how you said to kind of have it be for everybody. So nobody feels like they're singled out and they're punished. And like asking them to respect, the plan that you and your significant other have developed out of your feelings, and likely a lot of it is out of the guidance of your OBGYN or...
Yeah, you're just, explain to people that, you're just following the rules and recommendations of the hospital, your OBGYN, and if you both are confident in this plan, then that's the most important part. And people will see that confidence, and they'll be less likely to question you and kind of, break that boundary.
Absolutely. So, Lauren, as a clinician, what can we do to normalize this experience for our parents to help them reduce stress and anxiety?
Well, like we're talking about, it's just such a difficult time because we're all navigating these waters together. And, most of us never experienced anything like this before as clinicians, patients, families. So it's kind of all new to us. In regards to these milestones and celebratory events with friends and family, this can be a major source of sadness for new mothers and fathers as they kind of mourn the loss of those firsts. When you're pregnant, that sometimes you may not feel great. You have body changes, all these things. And a real highlight of that is those fun times like showers and shopping for new things and all these kind of firsts that we get to experience together with our husbands and even our moms and our families, if we're lucky enough to have that. But what we can do for our clients is kind of just let them mourn that loss, provide them with space to just, kind of grieve the loss of those things. And we don't have to try and make it better in that moment, but we can just, let them kind of express it, grieve the loss of those things, empathize with them, and then we could start giving suggestions on how to kind of make it a better time. And we don't want this time to go by where there's no joy experienced and, our patients are focused on just the negatives. We really want them to be able to grasp onto the positives. And with that, the best advice or the tools I use for that is kind of reframing. So we have these negative thoughts and we want to be able to help our patients reframe them and insert our positive thoughts into that. And there's a lot of ways that we can do this. So one important thing I like to help my clients remember is to avoid the mindset that everything is happening to you, right? Sometimes it could be, oh, this is just happening to me. Why is everything always happening to me? This is unfair. No one else has ever gone through this. Why can't I have a baby shower? These are normal things to feel and they're really sad. But we can remind them that it's not happening to you. It's just happening around them. And while it stinks and it doesn't make it any better, sometimes hearing that something is happening around us and not to us can kind of make us feel a little bit less anxious about it.
It feels lighter, like it's not to you kind of, I think,
it's
burden.
Not personal against you. It's nothing you did wrong. It's not that you decided to have a baby at this time. And we really want to avoid black and white thinking, like, because this happened, well, that means that, I shouldn't have got pregnant and this is the wrong time, and we could kind of spiral out of control. Mm-hmm. And it's really important to bring it back. Again, it's not happening to us, but it's happening around us. So this is like a collective crisis that we're all experiencing together, and it impacts everybody differently. So just a small change in mindset can be the difference between empowerment and disempowerment. And we want to empower our families. This is a time when we need all the power we could possibly get. We want them to feel empowerment through pregnancy, birth, and then through the postpartum period. So knowing that there's unanticipated challenges that mothers faced and they were successful should empower you and add hope and confidence. So remember that there have been mothers who have faced many crises in delivering and have successfully done this. It may not look the same and it may not have been COVID-19 specifically, but across the world, mothers have been pregnant and given birth in a time of crisis, and they've been successful in doing it.
And I think reminding ourselves that we are, reminding our clients that they are strong, that they can do this, and that they can rise and face this challenge, and it can be successful.
Yeah, I like to think empowerment versus disempowerment. So what kinds of things are we providing our clients with that will empower them? And then what kinds of things, or cognitions are they using that are disempowering them? And our job is to point those disempowering thoughts out and work on restructuring them.
Good. I like that way to kind of help them reframe it and look at it from an empowering standpoint. So for new parents, sometimes our little bit of a break, a little bit of time away from the baby, we could have parents come over and watch the baby, which might not be, or go out to a restaurant, which based on where people live, it might not be a possibility. But what can we encourage new parents to do for self-care during this time?
Well, like we were talking about the cognitions. So I really think, looking at these kind of negative cognitions. So if somebody might come in, telehealth, because no one's probably in the office or rarely. But if somebody says to you, oh, my mom would have came and watched the baby and me and my husband could have went on a date night or something like that. Or, if COVID-19 wasn't happening and the baby siblings could have came into the hospital and boy, that would have brought me a lot of joy. We really want to focus away from these what ifs and these negative thoughts and replace them with positive. Well, I don't like to always say positive, but replace them just with different ones. So I like to recommend using kind of imagery. So for example, I'll have patients visualize kind of a wave and them riding it, right? Or tree branches being flexible, blowing in the wind. This may sound funny, but when you picture those things, how do you feel? Like you're kind of going with the flow and just, kind of, you're not challenging everything. You're kind of just taking information as it comes, like we're kind of trying to do with COVID-19 and changing hospital regulations and changing family dynamics. So using that imagery can kind of really help us kind of, just picture ourselves taking things in and not kind of overanalyzing it. Sometimes I even like to suggest a mantra works well with imagery. So you can say something as simple as, I go with the flow, or something like, I handle new information with ease. And it may sound hokey, but the more you keep saying these things, the more you might even trick your mind into believing that they're true. So if a family member or somebody says something that you don't agree with, then you can kind of, remind yourself of your mantra, I handle new information with ease.
Yes.
And talk yourself right through that. So speaking of some self-care during this time, well, it's a challenging time, and as I'm sure even you and I know, that we have different kind of ways to deal with stress on a normal basis. And now with the restrictions in place and kind of having to keep, trying to follow everything, wear a mask, keep 6 feet, all those things, it kind of gives us a challenge of finding new ways to relieve our stress. So I think that one really important thing to do is to make sure we're staying in touch, like we said before, with family and friends. This can be done through FaceTime, Zoom, phone, text. You can still share pictures of that growing belly. The positive is you won't have strangers touching it.
That's
hopefully.
good point.
Hopefully they're keeping their distance if you're out somewhere. But you can still share those things. You could still take pictures and put on the little, marker of weeks if that's something that you wanted to do. Some people have no interest in doing that generally. But if that's something you picture doing through your pregnancy, then continue doing that. Relationships and connections are for sure the cornerstone of happiness. So making a conscious effort to connect, even if we have to schedule it and it feels weird, these things will really lift our moods and play a positive role in our mental health. So again, even if you have to schedule these meetings with family or friends, it's really important to put in the extra effort.
Absolutely.
Then we have, exercise and, any kind of movement is going to increase your mood. Just get your body moving. There's yoga, free YouTube videos, walks, apps. There's just so many options out there that you can do in the space of your own home, on your front porch, in your basement. So even just a 5-minute stretch in the morning or at night can really make a difference in how you're feeling and your mental health. I like to suggest maybe, another self-care would be, we often hear of nesting during pregnancy. So, what a time to nest. You could be nesting every day. Be careful not to get overwhelmed with nesting and drive yourself crazy. But, I like to think of it, you can declutter or do little home updates. Now may be a good time to kind of clean out the pantry if you're feeling up to it. Start preparing some freezer meals for when the baby comes. Set small goals so you don't get overwhelmed by the larger tasks. Work in small increments daily. You could set a timer for, say, 25 minutes and chip away at a larger project. Because remember, you still are growing a baby and you're going to feel tired. You may be nauseous or sick. So these are all just suggestions. These are in no way saying that you should be doing all of these things. Again, these are just things to kind of increase your self-care if you're stuck home during quarantine or isolation.
And I like, instead of saying go redecorate the baby's room, but you suggest breaking it down into smaller, more manageable time frames. Just do a power hour, 25 minutes. You don't have to, gut the whole closet. You don't have to do these large projects, but breaking them down into something that they can be more successful at and might have more energy for.
Yeah, that's, a big project or a big task like that can be really overwhelming, especially for someone if they have, some depression or increased anxiety during this time. I mean, it's kind of like, we're in a pandemic and you want me to go decorate a baby's room. I mean, I have bigger things to think about, but those are things that are going to bring us some joy. And they're things that we would have probably wanted to do, if this pandemic wasn't happening. So I think that breaking it down into smaller increments really helps. Like you said, the power hour I love. So basically you set aside 1 hour per week and you could I throw all my weird tasks into that 1 hour. So maybe my 1 hour this week will be, wow, I have a lot of empty picture frames maybe for years sitting on my shelves. So for that hour, I kind of go around and, print out pictures I need or order them or just check that off my list. So you're kind of breaking it up into more manageable tasks so you don't feel so overwhelmed. And it's amazing, what you could knock off in 1 hour.
Absolutely.
And feeling accomplished really can increase your mood.
Absolutely.
Also reading, right? So, many of us are finding that we're home more. We can't go the places we used to. So, why not pick up a book, a parenting book, or whatever interests you? You and your partner could kind of take turns reading it and discussing it. Or just pick up a novel that you normally wouldn't have had time to read. I like to think of it now that I'm kind of working remotely most of the time, I used to have an hour commute on the way to work there and back. So I'd kind of take that hour as a time when I can do something I normally wouldn't have had the time to do. So it's kind of like a treat, an extra hour you get. A great one is mindfulness and meditation. So research is really showing that mindfulness and meditation not only changes our perspective, but actually works to require our brains to think more positively. So it actually changes our thoughts and emotions. So apps like Calm, Headspace, or Insight Timer, they can all be helpful if you want to try and practice or get the hang of it. But just simple mindfulness exercises can really help.
And I like all of your recommendations because it's not anything that you have to run out and buy. But all of these things that you've mentioned are accessible within our own home. You don't have to, run out to Home Depot and get a whole bunch of new things, but you can just do like small tasks. And so I like that they're simple, they're easy, they're things that don't require a lot of running around, but they're small things that you can do, within your home. And some of these apps you can access right from your phone.
And these are self-care. These aren't treatment. We're not talking yet about like our treatment modalities.
Yeah.
These are just suggestions that we can give our patients, and encourage them to do these self-care things. And these all will help them throughout this time.
Absolutely. And as you mentioned, treatment modalities, can you talk to me a little bit about what you prefer to use when working with those struggling with perinatal mood disorder?
Yes. I really only like to use evidence-based treatments. So specifically for maternal mental health and perinatal mood disorders, CBT or cognitive behavioral therapy, and interpersonal therapy. So those are both highly effective in the treatment of these disorders. In addition to those treatments, other things that can really help someone who is struggling is, again, getting that support from others, exercise, adequate sleep, and a healthy diet. So these can all be really difficult things to do during pregnancy or for new moms, but it's important to work with their partners and them to really help moms set aside a special time where they can, walk with the baby or, take a walk while pregnant and listen to a podcast. But getting that movement, getting adequate sleep as much as possible, and really trying to nourish our bodies in the postpartum phase are all things that are going to have a direct effect on our mental health.
Yeah, absolutely. And I like that reminder of how food can impact how we feel mentally. And it might be even worth recommending that they talk to a nutritionist to kind of see, get some guidance on healthy foods or picking up some books on what foods can help improve their mood. One of the questions that I see a lot on messaging boards and groups, clinicians are always looking for book recommendations to pass along to their clients. Do you have any book recommendations that you would recommend to help expecting parents or parents of newborns who are struggling?
Sure. So anything by Karen Kleiman. She's one of kind of the pioneers of postpartum depression and perinatal mood disorders. So again, Karen Kleiman has a number of books that are, so popular, so informative, and just written in a perspective that mothers can really identify with, and never shaming or guilting, but really resonating those thoughts and those feelings, and again providing that hope that we all want to give, and that our clients really need during this time. So one of them is This Isn't What I Expected: Overcoming Postpartum Depression, and that's by Karen Kleiman and Valerie Davis. Good Moms Have Bad Days. That's a recent one by Simpson, and that's also a great one. Dropping the Baby and Other Scary Thoughts. That's another one by Karen Kleiman. And, that's just a really important one to kind of normalize for mothers, these kind of intrusive and scary thoughts that we may have. Good Moms Have Scary Thoughts, A Healing Guide to the Secret Fears of New Mothers, again by Karen Kleiman. And another one I love is Happiest Baby on the Block by Harvey Karp, MD. And that one is kind of just talking about what to expect with your new baby.
Some of these titles of these books, it reminds me of that popular book that comes out for new moms, What to Expect when you're expecting, and it kind of, it sounds like these books, just based on the title, it hits like what you're not expecting and what maybe people don't talk about and what you don't see other parents like present or show. It's kind of this other side of it. And it sounds like Karen Kleiman really tries to hit on normalizing these scary thoughts and some of these things that can come into play during parenthood. So
I like to say too, if this wasn't normal, there wouldn't be so many books written about it, So this gives us a kind of a clue into that. Oh, wow, these are kind of normal thoughts, I also remember hearing from somewhere someone saying like, okay, I kept picturing my baby falling down the stairs when I would carry them down. And that could frighten somebody so much. Like, why am I picturing this? This is so weird. But the fact that you're thinking that it's weird and that it's kind of a weird negative thought is just showing you that it's kind of a thought that's just coming and going. It's not actually going to happen. You're not actually going to trip and fall with your baby down the stairs, even though you might think every time, that's something that you picture. That's like an example of an intrusive thought that is kind of normalized by Karen Kleiman in all these books, and other scary thoughts too.
Yeah, absolutely. And then if that thought then turns into really having a plan and taking action, that's when we need to explore the psychosis part of postpartum depression.
Yeah, and that actually is, again, in the first psychosis is really, the postpartum psychosis and really is prevalent in the first 2 weeks after birth. So doesn't mean that it wouldn't happen after, of course, but it's something in the change in hormones and mood that could make it occur in you. But it's so rare that we just want to be aware of it. But I don't want to in any way scare new mothers or think that by talking about these things, it means that you are going to experiencing them. Most new mothers are going to maybe have a little bit of like the baby blues, a little bit of anxiety. But if you do have these thoughts or you do have any one of these perinatal mood disorders, we want to normalize it and say, we're more alike than we are different. So if you're having this, then it's probably safe to say that some other mothers have felt this, likely in your circle of friends. And if you talk about it or you mention it, I'm sure there's going to be probably, the statistics say 1 out of 7 have postpartum depression. So think about a group of 7 girls, 7 moms, you guys are going to be able to relate to each other more than you thought you would.
Yes, and encouraging our clients to not only maybe have these conversations with us, but having these conversations like with their support system as well to kind of help them see that exactly what you said. We are all more alike than different. And it's not scary to have these thoughts, but it happens. And if you recognize that it is a scary thought, that's a good thing, because thoughts can be free floating and we can recognize them and notice them and acknowledge them and then be able to kind of move on to something else or take note and say, I'm going to talk about that in therapy, or when my spouse or my partner comes home, I'm going to talk about that with them.
And they might have them too. Dads can have negative, intrusive thoughts too. So if you bring it up, they might not be that surprised by it. No one's going to think that you're nobody should think that you're a bad mom or a bad dad or anything is necessarily even wrong just because you thought these things.
Yeah.
I remember looking over at my newborn thinking, gosh, why on earth did I do this? Obviously that changes, or sometimes it doesn't. Sometimes you still think that, wow. But, that was a thought that was really scary to me. Like, I'm supposed to be feeling all these positive things 24 hours, 7 days a week. I never heard anybody, even friends, say that they had a similar thought. But then you mention it and suddenly it's like, oh, I had thoughts like that too. Like, oh, I didn't enjoy the time, in my postpartum every hour. You're tired, you're exhausted, your life has suddenly changed in so many ways. And it's, totally normal to think these things. And we want to, again, remind our patients that these are normal and then again, realign their thoughts onto the positive. So, what were the things that they were excited about doing? Okay, let's do them.
Let's execute some of those things that we were looking forward to doing in parenthood. Well, I want to thank you so much, Lauren, for coming on the show today for our first episode. And hopefully we have many more to come and many more clinicians, and maybe we'll have you back to kind of talk about substance abuse. And so just thank you from the bottom of my heart for sharing your knowledge and expertise in this area. I'm going to post some of the links to the resources that Lauren mentioned on our website. It's therapeuticperspective.com. And if you have any questions or comments, or if you want to be a guest on the show, you can email us at therapeuticperspectivepodcast@gmail.com. We look forward to hearing from you, and thanks again for joining us.
Thank you.